Today I discuss about the pathophysiology of depression. Okay. The major depression disorder, it is the mood disorder that caused by the persistent feeling sadness and loss of interest is called of the major depression disorder, a clinical depression. What is the symptom of depression? Depression, feeling sadness. The symptoms, there are various symptoms of the depression such as feeling sadness, hopelessness, angry outburst, irritability, frustration, even on small matters, and loss of interest are most of the pleasure activities such as the personal activities, sex activity, hobbies and sports, and sleeping disturbance including insomnia or the sleeping too much, and tiredness and lack of energy, and so small tasks of taken efforts, reduce the appetite, loss of weight and increase the weight. Next, the continuous, some also symptom of depression such as anxiety, agitations, hopelessness, slow thinking, speaking and body movement. These activities become too slow, and feeling worthlessness, guilty, fixing on a post failure and self blame. Person is blaming every activity on self, their worthlessness, guilty and their failure. And the trouble of thinking, concentration, thinking करने में उसको trouble होगा, decision making, remembering, thinking, सब में से problem होगी. Frequent recurrent of the death and mood of suicides. If that attempt to the suicide, that also include such a problem after, so as the back pain or headache. Next, the causes of major depression disorder. There are many causes. Some different factors such as some factors contribute on the major depression like genetic stress, certain medical conditions, or brain chemistry. What is the brain chemistry? There are different neurotransmitters include that reduce the concentration by the passing the presynaptic cleft to the postsynaptic cleft. That's why may induce the depression such as serotonin also known as happiness hormone, and dopamine, noradrenaline. If that neurotransmitter decreases inside of the synaptic cleft or reaching the postsynaptic cleft, that induce the depression. Reuptake neurotransmitter from synaptic cleft to the presynaptic neuron. You know, if the neurons is the release from the presynaptic cleft to the postsynaptic cleft, but it reuptake again presynaptic cleft, it means reduce the chemical transmission that induce the depression. Next, you can see the synaptic cleft. The amine neurotransmitter are either degraded by the help of myoenzyme and comet. That are enzyme that destroy the neurotransmitter. And whenever release the neurotransmitter, this is the presynaptic, this is the synaptic cleft, and this is the postsynaptic. After releasing it binds to the receptor, beta receptor, or passes the postsynaptic, means normal activity. But it's destroyed and reuptake in a presynaptic cleft, that induce the depression. This is the physiology of the depression. Next, thank you for all about the depression.